My name is Dr. Manrina Rhode, and I want to talk to you about occlusion and smile makeovers. So it's taking the most boring part of dentistry and the sexiest part of dentistry and putting them together and seeing how they have to live in harmony and how occlusion is so important for a beautiful smile makeover. So typically when a patient comes to see you to improve the appearance of the smile, then it's the front teeth that they're coming to see you about. And quite often when they come to see you about the issues with their front teeth, there's some anterior wear there that's distracting them. If there isn't and it's gaps and whitening and whatever else, then great, and I'm not too worried about occlusion, and I'm not too worried about what it is that they're doing. But if there's anterior wear and that's what their concern is, they're shortened teeth or they're uneven edges, then if you don't consider occlusion and you don't consider why that wear is there in the first place, then you're going to have problems. So maybe it's a habit, right? Maybe they're fingernail biting, maybe they've got a habit, they bite pen ends, or whatever else it is that they do. And if that's the case, then okay, then address the habit. That's also very important. But if it's parafunction, and if rather than grinding on their lovely big back teeth where they've got nice bone and multiple roots to protect those teeth and hold them in, that if they're not grinding on those back teeth, then there's a reason why they're choosing to bring their lower teeth forward and grind on their front teeth. It's not a natural thing to do. The front teeth are single-rooted teeth, and the bone is very thin around them, and there are proprioceptors around your front teeth that stop you from doing that. If you ask me to grind on my front teeth, I really can't even do it. It feels awkward and not comfortable. So for patients to get to a point where rather than grinding on their back teeth that are really designed for that, obviously tensing your facial muscles releases endorphins that make you feel better. So it's something that patients do, high functioning people do to help them. A lot of dentists grind their teeth. You know, I could be doing a full mouth case for 6 hours and clench and release for the whole 6 hours. And it's not that I'm not enjoying what I'm doing. I'm high functioning, and those endorphins are helping me cope with what I'm doing at that time. So if a patient comes to you and they have wear on their anterior teeth, and you can see that those wear facets line up very well with their lower teeth wear facets, so there's an anterior grinding habit going on, then we want to consider why they're grinding on their front teeth. And typically, when that's happening, it's because the TMJ joint, the condyle that sits within the TMJ joint is not perfectly seated when the patient bites together. So their maximum intercuspation is not equal to their centric relation to when their condyle is in its most posterior superior position. And there's going to be a reason for that. It's going to be because the way their wisdom teeth came out, because of a restoration they had that threw it off, because of orthodontic treatment that they had, or maybe that's just the way that they developed. But that's the issue. And then because it's then uncomfortable, because when they try and bite on their back teeth, maybe the condyle is seated on the bone there. And then that's quite sore. So then they don't grind on their back teeth, and instead they bring the condyle out of the joint and they grind on their front teeth, despite the proprioceptors telling them not to do it. And then they end up with this anterior wear. Now, if the habit that they have is bad enough that they've overridden the proprioceptors that you have in the mouth, and they've shortened the front teeth and they've eaten away their own enamel, then they are gonna eat away and they're gonna break your restorations. So you're not gonna be friends, because you're gonna have a continued issue with them. So you need to solve that problem first. You need to see if you can get their jaw realigned, which also will help with a whole range of things. It will help with their neck alignment. It will help with their back. With their back alignment. A lot of patients are seeing osteopaths and chiropractors for their back issues, when really it's all starting up here in their TMJ joint. So if a patient's grinding their teeth and their CR and MI are coincident, if their TMJ joint is seated and their teeth bite together, then you might just give them a traditional night guard. This is the soft night guard, so their teeth are protected at night from that grinding habit that they're doing while they're sleeping. But if they If they're not, if that's not happening, if it's not coincident and they're not grinding on their back teeth, they're grinding at the front, then you might want to get them a deprogrammer, like an anterior SCI or NTI, that can go on their front or bottom teeth, has a little beak in it to stop them from coming over it, because they'll try so hard to get their back teeth together, they may try and flip over the front of that guard. And then that way it can help their jaw to realign in the correct position and help align everything for them. And then through bimanual manipulation and having a look at their mouth, you can find out where their prematurities are, and that's a whole different occlusion lecture. Once you've got them so that their TMJ is seated so that their CR and their MI is coincident, then you can restore their front teeth, and you know that they'll grind on their back teeth because they're still going to grind. And if you feel like you can't do that, then you may want to open up their bite. They'll have most likely worn away the anterior incisors and overclose their bite. So build up with composite edge bonding and open up the bite, and then kind of dial the teeth in and let them over-erupt and dull and rejoin and hopefully join in a more comfortable position, so then they're not breaking their composite bonding, edge bonding, and then you know that you can comfortably move over to veneers. It's a big topic, and hopefully that gives you a little bit of an understanding about it. We love to support you within my mentorship program and talk about all the different ways that smile makeovers can be done in a predictable way, so that your work is lasting and you can enjoy your career and work in a comfortable way. So if that's